Hello, this is DrDanielMurtagh. This presentation will cover male urinary incontinence. It will focus on the causes and will review the newest surgical solutions to this problem. Urinary incontinence is the involuntary loss of urine. It is usually caused from bladder or sphincter dysfunction. It is not unlike having a faulty washer in your water spigot. Urinary incontinence is a very common problem. 2 million men suffer from this problem. It is a common complication of prostate surgery. You do not have to live with this problem. There are solutions available. Urologists specialize in treating this problem. Your primary care doctor can help you select one if you don't already have one. There are 3 types of urinary incontinence. Stress incontinence is the leakage of urine during physical activity like lifting, laughing, coughing, or sneezing. It is a problem with the urinary sphincter muscle, not the bladder muscle. Urge incontinence is leakage associated with a sudden urge. This is considered a bladder problem. Mixed incontinence is when there is both a bladder problem and a sphincter problem. This presentation will be focused on stress urinary incontinence. It is helpful to know the anatomy. The bladder fills with urine and stores it. The sphincter is the valve that keeps the urine in the bladder. Normally, it stays closed until you relax it in order to urinate. It is this muscle that is affected in stress urinary incontinence. The most common causes of stress urinary incontinence are listed here. Prostate surgery, both radical surgery for cancer and the TURP for benign disease, as well as other causes such as pelvic surgery, trauma, spinal disease, and neurologic disease. Dealing with urinary incontinence can cause a loss of self-image and self-esteem. It can lead to embarrassment, isolation, and depression. It can also be a financial burden with the cost of protective garments. The treatment options for stress urinary incontinence are protective garments, medication, external devices, and the focus of our presentation, surgical procedures. There are 3 surgical procedures available to correct this problem: Invance male sling, Advance male sling, and the artificial urinary sphincter. The Invance is for mild to moderate levels of incontinence. It is minimally invasive and can be completed in less than an hour as an outpatient. The results are immediate with an 88% satisfaction rate. The sling creates gentle compression on the urethra after it's attached to the pelvic bone. The Advance male sling also treats mild to moderate incontinence. It too is fast, effective, done as an outpatient, and enjoys a high patient satisfaction rate. The Advance male sling requires 3 small incisions to position a sling beneath the urethra to restore the urethra to its proper anatomical position. The artificial urinary sphincter has been available the longest and is considered the gold standard of treatment. It is effective for mild, moderate, and severe causes of urinary incontinence. It is a 3-piece device that acts like a blood pressure cuff around the urethra. It opens with the use of a pump in the scrotum. It automatically closes after urination. It too has a very high satisfaction rate. So, what should you do next if you suffer from this problem? See your urologist. If you do not have one, your primary care physician can help you find one. In summary, incontinence is a common problem. Most everyone can be successfully treated. There are new surgical treatments that are available in addition to the gold standard artificial urinary sphincter. So talk to your urologist. You can live life dry. As with any surgical procedure, inherent risks are present. Although rare, some of the most severe risks include infection and erosion. See the instructions for use for complete information. For additional product and risk information, visit www.americanmedicalsystems.com. Support for this presentation was provided by AMS, the world leader in male incontinence. Thank you for your attention.